Well, my name's Ted Townsend, and I'm the author of the LaingBuisson report into private acute medical care in central London. This is the first time, despite all the energy and inquiries that have been going on at the government level and the monopoly discussion, that anyone's really looked seriously at the central London market in terms of results, historical growth, who the operators are, what share of the markets. So for the first time, we put that together in a very authoritative report. And it complements the national report that LaingBuisson have been publishing for the last few years.
Great. So what will you be talking about at the Private Healthcare Summit?
Well, I'll be looking at some of the different dynamics between central London and indeed the national report. So they're displaying some very different growth rates, some both in revenues and in patient numbers, and also the sources of those revenues in terms of where they're coming from, the NHS, private patients, overseas patients, etc. So playing it out, comparing and contrasting the different fortunes of some parts of the UK versus other.
Great. And why is that such a pertinent topic right now?
I think for the private hospital operators, it's been a tough market for the last 7 or 8 years, certainly since before the recession, with declining sort of private patient numbers coming through insurance, as well as private patients just on their own being more wary of self-pay. But in London, there's some opportunities that you can see. London, in fact, has been growing quite consistently over the last few years, and so maybe there's some lessons there about where the sources of patients and indeed therefore the revenue come from those hospital operators that are in central London, and maybe other people can take a view as whether or not it would work in their own markets.